let's jump right into the conversation. And first, though, let me remind the audience that if anyone has a question, feel free to pass it on to us using the Q&A button at the top, at the bottom of your screen. Now, Laura, you close with like, an audacious statement saying that we should be trying to actually not just prevent disease and cure disease and suffering, but to actually create health. And it is audacious, but it resonates with what Mark and Jaywan said. I'm sure that many people who are watching were thinking of all the reasons why that's not possible. Who's going to pay for health being created? The fact is we all have to go downhill eventually, and health can't be maintained forever. But what's the positive side? Like, what's the counter to that? What will be the market forces, the pressures, the rewards for organizations that might be successful in creating health that you can see and you actually expect to happen over the next decade?
Well, so first of all, I have to declare that I'm an optimist by nature. And it's way more fun to help people stay well. We're always going to provide beautiful rescue care. That's an essential ingredient in overall health. But I have seen another place where people had had a better health status than we did, and we spend a lot more money on healthcare in our country. And for the first time in a long time, life expectancy of Americans has been on the decline. So our current system is unsustainable. We need to redirect how we're spending on helping people live their healthiest lives, because we all want to feel as well as we each possibly can. And I believe that as we continue to go on this collision course, if you will, there will be more of an interest, and you can see some disruption in the market where people are pushing for this. And I expect that only to grow.
Oh, that's interesting. I mean, you're actually bringing up like a Michael Porter theme, like he looks at nations and their ability to compete with other nations. And you were suggesting that if the United States is going to compete with other societies, then we had better figure out how to go about creating health. Now, Mark, you use the phrase "going upstream" as your version of this idea. Like, can you give us any examples of that might make this feel real, like this, or something that's actually happening now from what you and your colleagues are doing at Intermountain?
Absolutely, Tom. Thanks for asking. So right now, about 45% of the work we do is done in an environment where we take full clinical and financial risk for patients. And so it makes sense for us to do things that really do substantively address social determinants of health. So whether it's the 500 affordable housing units we helped create this year, whether it's making sure people have transportation so they can get to their appointments, whether it's giving people broadband access and digital devices so that they can interact with our healthcare system, whether it's actually assuring food security, not only for the people we care for in the community, but actually for our own caregivers. It became apparent during the pandemic that we had food insecurity, even amongst the people who work for Intermountain, and we're trying to make sure that that never happens again. So those are all examples, Tom, and I don't think this job's ever going to be done, but it really is incredibly gratifying when you can help people make sure that they stay in their house and they don't experience homelessness based on not being able to make one rent payment.
Now, Jaywan, I'm sure you got comments on these things, and you can offer them. But I wanted to turn to you with, you made the field of dreams analogy, and which with like criticizing the attitude we've had that if we build it, they will come and they will figure out how to park and how to make their way through our halls and register in 2 or 3 places and so on. And we know that that's not the way it ought to be, or it will be in the future. But if we really do make care, organized around patients and more convenient and available 24/7, I mean, that is really different from producing a great visit or producing a great ambulatory surgery operation. How will you be organized to do this? What will be the units of analysis when it's not the hospital and the visit, how will you manage?
Yeah, I think you raise a great point, Tom. To me, it feels like the units of measurement simply get more longitudinal in nature. Instead of measuring the output from a single visit or from a single encounter, I think the things that we measure have to be and have to move more towards a longitudinal, holistic picture of what's the total cost of care, what is someone's perception of their access, how often are they landing in the hospital or the emergency room, what has been their overall experience. And I think this is, it goes hand in hand with your earlier question. I think if you look out to 2030, I would argue that, I mean, in addition to what Mark and Laura raised, I think it's really a race to grab the hearts and minds of the consumers. I think that's what's really at stake. And the fastest path to that road is by going upstream. You get to touch people and engage people in ways that you can't when you're just interacting with them for that single encounter. And oh, by the way, that encounter has them having difficulty parking and wayfinding and so forth. It becomes more meaningful and potentially more impactful when you're able to engage with them in a way that deals with, you know, many of the issues that Mark raised. Whether it's food or care in the home or care virtually, making things easier for them to access and improve their health.